What is RNS and DBS for epilepsy treatment? Imagine a way to help control seizures without removing parts of the brain or relying solely on medication. That's where neurostimulation therapies like responsive neurostimulation and deep brain stimulation come into play. These are advanced options for people with epilepsy that hasn't responded well to medicines and who aren't candidates for traditional surgery. Responsive neurostimulation, or RNS, involves implanting a small device in the skull connected to electrodes placed directly at the seizure focus in the brain. This device constantly monitors brain activity for signs that a seizure might be starting. When it detects abnormal patterns, it delivers tiny electrical pulses to interrupt or lessen the seizure activity right at its source. RNS is approved specifically for drug-resistant focal epilepsy, meaning seizures that originate from one specific area in the brain. One of its advantages is that it provides personalized, on-demand stimulation, which can adapt to the patient's changing needs. Plus, it records brain activity, so doctors can review the data remotely and fine-tune the treatment over time. Deep brain stimulation, or DBS, works a bit differently. It involves implanting electrodes deep inside the brain, usually targeting structures involved in seizure activity, like the anterior nucleus of the thalamus. Unlike RNS, DBS does not monitor brain activity in real time. Instead, it provides continuous or scheduled electrical pulses to help regulate abnormal brain signals. This ongoing stimulation can reduce how often seizures happen and how severe they are. DBS has been shown to significantly lower seizure frequency in many patients and is approved for epilepsy treatment as well. Both RNS and DBS are considered alternative therapies for those who cannot have or have not benefited from brain surgery that involves removing tissue. They do not involve cutting or destroying parts of the brain but instead use electrical signals to help keep seizures under control. The choice between the two depends on factors like the type of seizures, where they originate in the brain, patient health, and the experience of the medical team. Studies show that both therapies can lead to meaningful seizure reductions, but there is no clear winner in terms of which is better. Ongoing research continues to explore how best to use these options and understand how they work. In summary, RNS is a closed-loop system that detects seizure activity and responds with targeted stimulation, offering a personalized approach with the benefit of brain activity monitoring. DBS provides steady or scheduled stimulation to deep brain areas to modulate seizure networks without needing to detect seizures in real time. Both are FDA-approved options for managing epilepsy when medications and surgery aren't suitable, aiming to improve quality of life without removing brain tissue. Deciding which therapy is right for a patient involves careful evaluation by epilepsy specialists, considering individual seizure patterns, health status, and personal preferences. If you or someone you know is exploring these options, it's essential to consult with healthcare professionals who can provide tailored advice based on the latest evidence and guidelines. These neurostimulation treatments are important advances that help many people live better with epilepsy while adhering to established medical standards.